canine, feline, and mink parvovirus, so canine enteritis. It's widespread worldwide because it's seropositive. It's frequent in dogs due to widespread vaccination. The etiology of the disease. So canine parvovirus 1 is non-pathogenic. It causes canine minute virus. It is called carnivore Boca parvovirus 1. Canine parvovirus 2, also known as carnivore protoparvovirus 1, is a mutated form of feline PV. The virus originally comes from a cat, but cats are not susceptible. But the new variants have emerged making cats susceptible to it, such as canine parvovirus 2A. Canine parvovirus 2B is from America and Asia, and there's also a canine parvovirus 2C. The newest mutant is canine parvovirus 2AB. The epidemiology of the disease. So it's found in Canidae, such as dogs and wolves. They're both susceptible. There are 3 viral proteins, viral protein 1, 2, and 3. Viral protein 2 neutralizes antibodies. The virus sheds in the feces. There's a massive shedding of the virus on the 3rd and 4th day. The virus has a horizontal infection. The virus affects animals of a young age. They're susceptible up from 3 to 8 weeks. There's a high mortality. The maternal immunity lasts for 3 to 4 months. Above 8 weeks of age, it causes a stinky, greyish diarrhea enteritis. So the pathogenesis. The virus is consumed orally and it enters the lymphoid cells, and such as the T cells and the throat and the gall in the small intestines. This is the primary replication. Then there is a cell-bound viremia for 1 to 2 days due to the leukocytes. It then reaches the rapidly dividing cells, and this is where the secondary replication takes place. These cells are number 1, the lymphoid cells, such as the bone marrow, spleen, and liver. It can cause lymphopenia and neutropenia. And number 2 are the crypts of the small intestines. This damages the intestinal villi. And number 3 is the myocardial cells in young animals. The incubation period is 3 to 7 days. The clinical signs are viremia, fever, depression, anorexia, lethargy, gastrointestinal, such as vomiting, and mucoid hemorrhages and bloody diarrhea. The histopathology is, in the intestines, you can see inflammation, hemorrhages, and desquamation. And you can also see nuclear inclusion bodies. There is also a decrease of lymphoid cells in the spleen and mesenteric lymph nodes. For the diagnosis, look at the clinical signs or the postmortem lesions. You can directly find the virus through PCR or hemagglutination. You can also do an indirect test by finding the antibodies in the sera on the 3rd or 4th day. You can also do a rapid test by checking the feces. The differential diagnosis is the rotavirus, the coronavirus. These replicate on the tips of the villi, but they don't cause hemorrhages. It can also be mistaken for herpes virus, as this also affects young pups from 2 to 3 weeks old, but herpes virus also has respiratory signs. The treatment is to do supportive therapy, and you can also give antibiotics to stop a secondary infection and to quarantine them. The prevention is vaccination. The maternal antibodies can protect the pups up to 3 to 4 months of age. The vaccine is an inactivated, live attenuated virus. The next disease is feline panleukopenia. The occurrence is widespread. It used to be lethal. It used to be infectious gastroenteritis. The frequency decreased due to vaccination programs. The etiology is the feline panleukopenia virus. The epidemiology, only Felidae are susceptible. It previously had a high mortality and it shed in the feces and by secretion. For the pathogenesis, it's the same as canine parvovirus 2. It causes anemia as the clinical signs as well. The virus can cross the placenta to the fetus and cause cerebellar hypoplasia. The clinical signs are fever and acute enteritis. This includes vomiting, diarrhea, abdominal pain. The diagnosis, treatment, and prevention are all the same as the canine parvovirus. The differential diagnosis can be herpes virus, which causes respiratory symptoms, and coronavirus, which has a longer incubation period and causes peritonitis. The next disease is Mink enteritis. The consequence of this disease, it has rapid replication of the virus. The virus replicates in a high amount. This causes acute enteritis with a high mortality rate. It's caused by Mink enteritis virus. It's related to feline panleukopenia virus. The clinical signs are fever, inappetence, and lethargy. The pathogenesis is the same as dog and cat parvovirus. And for the vaccination, an inactivated form of the virus can be given at 2 months old. The fourth disease is the Aleutian mink disease. It's also known as mink plasmacytosis. It's associated with persistent low levels of virus replication, and this can cause chronic severe immune dysregulation. The Aleutian mink disease virus can also affect ferrets. There is a genetic predisposition to the disease. It is a higher mortality in the Aleutian minks. It causes hypergamma-globulinemia. This causes immune complexes and leads to type 3 hypersensitivity. There is no neutralizing antibodies, which increases the number of non-specific antibodies in the plasma cell, and this causes an immune complex. The occurrence of the disease is worldwide. The pathogenesis, so it enters the body orally, and the primary replication happens in the lymphoid tissue, the throat, and the leukocytes, and it becomes cell-bound and causes viremia. The target organs are the spleen, liver, immune system, and the placenta and the fetus. The virus is carried and shed persistently by infected mink. So the clinical signs, it's a chronic disease. The incubation period is 4 to 6 weeks. The clinical signs are bleeding through the mouth and nose, anorexia, bloody feces, and nervous system signs. The animals have poor reproduction performance, and they have wasting. There is also an increase of congenital malformations and abortion, and the animals also have renal failure and uremia. In the post-mortem lesions, the animals have glomerulonephritis in the kidney, and in the arteries, they have arteritis. And there is also an increased plasma cell count, which leads to an enlargement of the lymph nodes, spleen, and liver. There is no vaccination because there is no neutralizing antibodies.